Hello, my name is Bran, and today I am going to be talking about asthma. My presentation is called Breathe Easy Asthma Action Plans for School Safety. So I would love to start by listing some reasons why should we have a plan at school for children with asthma. So number one, having a plan saves lives. Having an action plan reduces absences. Having an action plan creates healthier learning environment for children. And as you can see in the first sentence of my presentation, um, we have about 10 to 15% of school aged kids with asthma. Perhaps right now you're thinking about one of your students that have asthma. And like me, I didn't know what to do with this student. I thought, well, it's asthma. I don't really know that much about asthma. I know that sometimes kids with asthma have trouble breathing, but they have an inhaler and they can control it, and that was it, right? But it's more than that. We can educate ourselves and we can educate other students as well, and we can create an inclusive environment for these children when we do have an action plan. Before we develop a plan, it is necessary for us to understand childhood asthma. We need to understand that asthma is the most common chronic illness. It affects a lot of children in our schools and diverse demographics. Also, asthma is the leading cause of hospitalization and a major cause of absenteeism. Students with uncontrolled asthma miss significantly more school days than other children. But the good news is that with proper management strategies in place, like a plan, students with asthma can fully participate in school activities and maintain regular attendance. Well, now that we understand asthma a little bit more, let's talk about the action plan. What does the action plan include? Um, so, what is an action plan? An asthma action plan. An asthma action plan is a personalized written document developed by a child's health care provider. Yes, we don't have to write this plan. It's provided by the child's doctor. Um, These plans serve as critical communication tools between doctors, school staff, and family members. So that way, everyone is on the same page to provide help to the student and make sure that the student gets a good care everywhere, including school. So what does it include? It includes daily management. What is daily management? Daily management outlines regular medication. We get to know the triggers of asthma and how we can prevent these triggers. It also includes early warning signs. So in this plan, there are details of what are the symptoms, what do we have to be looking for when asthma gets worse, and when does a child requires intervention. It also includes emergency procedures, provides clear instructions for severe attacks when it's necessary to call 911. It also contains color-coded system, with green being a child is okay and yellow is that we need to watch out and make sure that the child is okay, or he uses an inhaler or something, and red zone is when we need to call 911. We need medical attention. So here is another reason why schools need asthma action plans. Um, as we know, students spend nearly half their waking hours at school. So it is essential that all school personnel are prepared to respond appropriately to asthma symptoms. Like we discussed before, these action plans can save someone's life. It can reduce someone's missed school days and empower school staff by giving clear instructions to anyone who may supervise the student. Um, and also, it improves academic performance. When students have an asthma that is well managed, there is a better concentration. They are not worrying about how are they feeling, but they're worrying about um, school work. To ensure an effective implementation of asthma action plans, we have to make sure that everyone is on the same page. And to do this, we have to make sure that plans are accessible, make sure that everyone understands these plans, and are consistently followed by all staff members. So there are a few ideas of what we can do at school. We can store multiple copies, we can keep plans in classrooms, we can keep them in the office, we can keep a copy in the gym. We can also add a small student picture in that attached to the plan. We can ensure that medication is accessible as well. Students should carry, for example, students should carry their inhalers because we never know when they will need it as well. Or we can ensure that staff should they know where the inhalers are in case the student doesn't have access to it. And in case one inhaler breaks, we have to ensure that we have backups available. Um, Training is really important. Not everyone knows what to do in case of an emergency. So it's important to train all staff members. Everyone should recognize symptoms and know proper inhaler spacer technique. And last, we can conduct monthly medication checks. We can verify the expiration dates and maintain organized inventory of students' medication. How we can do that? We can communicate with doctors or family members. Okay, so now we're going to talk about going beyond an action plan for students with asthma. We think, as teachers, we think, well, we got it all covered. We know about asthma. We acknowledge which kid has asthma. We communicated with family, doctors, and our staff members. We all know where the action plan is and how to help the student. Well, there's a lot more that we can do. We can reduce common triggers. We can use fragrance-free cleaning products. Sometimes we don't think about that. That is a trigger. We can control dust with regular cleaning. We can address moisture issues promptly and implement non-idling policies for buses. We all know that anti-idling policies help lower these emissions, bad fumes emissions that the buses produce. If we help those policies, then the air quality will be a lot better for the student if they take the bus. Another thing that we can do is modify our activities. We can plan for medication before exercise, for example. We can offer indoor alternatives to improve air quality, those minus 20 something days in the winter, or like really hot days in the summer, for example. We can allow warm-up periods before full exertion. We can monitor students during physical activities, keep an eye on those students with asthma. If we prepare a field trip, we can bring copies of action plans. We can ensure medication is accessible. We can research potential triggers. There might be more that we don't know of. We can research about the place where we're taking the students. Are there going to be any triggers for our asthma students or our students with asthma? We can explain chaperones of emergency protocols. These are the things that we can do to go the extra mile to help the students with asthma. These are a lot more ideas of what we can do to build a supportive community. We can educate peers. Other students don't know about having asthma. Perhaps the ones that don't suffer from asthma don't know that much. We can teach all the students about asthma to build empathy and reduce stigma. We can connect with healthcare professionals. They will be more than willing to help us and provide with resources and more education, or even contact a healthcare professional to come and educate our students about asthma. We can collaborate with staff. Regular communication between teachers, nurses, and administrators is very important. We can also partnership with parents, engage parents in developing and updating an asthma management plan, involve them in our plan. It's very important as well. So when we create a culture of understanding and support around asthma, benefits the entire school community. When students, staff, and family work together, children with asthma will feel safer. They will feel more included and better equipped to manage their own condition. They will feel good and included. They will feel that they're not on their own in this, that they are adults that care about them. And last but not least, I want to leave you with a list of resources where you can learn a little bit more. You can learn more about asthma and to help support students in the schools. The schools don't have to develop asthma management programs from scratch. You can find an organization that can actually give you an action plan for free, and you can help, and they can help you educate your students as well. They can provide with tools and materials specifically designed for educational settings. I found these websites. These websites provide you with a lot more information about lung diseases, not just about asthma, but any lung-related diseases. There is number one, Asthma Canada Resources, American Lung Association. This one, American Lung Association, provides a lot more details of not just asthma but any lung-related diseases. They also offer a helpline. They have professionals that can help you clarify all the questions that you have about lung diseases. And there is another one, Centers for Disease Control and Prevention, and the last one is local health departments.